Morning, everyone. This is Larry Boris with the National Association of Worksite Health Centers. I want to thank you for participating in our program today, acquiring the COVID-19 vaccine for your worksite clinic. We have two of our members and their vendor partners joining us today, and they'll be talking about their experience and what they've done and how they've gone about this process and some of the results and perhaps some of the challenges as well. So I think it'll be very interesting for everyone as many of us are moving into the area of return to work and wanting to offer the vaccine through our on-site or near-site centers. What we're going to do is I'll have each of the presenters talk for about 20 minutes each, and then we'll have the remaining time for questions. Please use the Q&A box on the bottom of your screen to ask questions. In addition, I'll be going around the table at the end of the formal presentations, asking each participant to make any comments or questions that they have. So if you don't want to put down your questions during the session, when I call upon you, feel free to ask at that point. At this point, I'd like to again begin. I want to thank everyone for participating. For those who may not be familiar with our organization, the National Association of Worksite Health Centers, affectionately called NAWIC, NAWHC, is a nation's only nonprofit organization for those employers and their partners who offer on-site, near-site, mobile, and virtual health centers, health and pharmacy services for their covered populations. We have about 110 members right now, includes public and private employers, unions, nonprofits, third-party vendors, health providers, advisors, etc. Our intent is to help employers understand this benefit program, because this is one of the many benefits that a health and wellness company would offer. And it covers all industries, it covers all sizes of companies, and many of our members are interested in learning how they can expand from occupational health or acute care into full primary care services. So we offer education and benchmarking services. We're in the middle of we're going to be sending out our Mercer NAWIC survey, national collection of information on the operations of worksite centers at the end of this month. We have purchasing information, vendor information, and we do speak out on behalf of the industry and employers and vendors who have worksite centers. Please go to our website at nawhc.org to see all the variety of resources, benefits, and programs we have, and sign up for our LinkedIn group as well to stay up to date. Our annual forum is September 9th and 10th. We do intend to have an in-person meeting in Chicago. We hope you'll be able to participate in that. So with that, I want to start off by including our first speakers. We got from the City of Goodyear and CARE-ATC. So let me introduce Dr. Terry Lyman, Scott Strickland, CARE-ATC's medical director, to begin the program. And he'll be joined by Jeannie Rudy, total compensation and HRS manager from City of Goodyear. So Scott, I'll turn it over to you.
Thanks, Laura. I'm actually a president and COO of CARE-ATC.
Thank you very much.
Yeah, no worries. And we have Jeannie online now, just to introduce the City of Goodyear. At CARE-ATC, we've, just for background on CARE-ATC, we've been working since March, really, just in our COVID response. We'll touch on that. That's largely been around testing and return to work and even management of conditions. Early in November, we started the process to register all of our locations to administer the vaccine, which I'll cover, but would like to turn the phone over to Jeannie for a minute to talk about the City of Goodyear, give more of a profile of the city, and
sorry about that.
That's okay. Always interesting with Zoom, but give a profile of the city and really what they were looking to achieve with providing vaccines to their employees.
Okay, good morning. Shoot, I almost missed it. I was thinking it was 10 o'clock Arizona time and I got a call. Thank you for whoever called to let me know that. Just a little bit about the City of Goodyear. So our population is just a little under 93,000 and we're about 20 minutes west of downtown Phoenix. We are a little bit more information. We have about 300 days of sunshine each year and we're home to spring training teams for Cleveland Indians and Cincinnati Reds. Just some fun facts. We have about 650 full-time employees. And when we started this, when COVID first came out, our essential list was much smaller. But as we started to move forward, our municipality and the services that we needed to provide, that list of our 650 full-time employees, about 550 of those were considered essential based on the definition. Those including our first responders, our law enforcement, and then other essential workers to provide services to our citizens. So the City of Goodyear has a really robust wellness program, and we really talk about the whole employee, and our culture here is around wellness, and it's more than just physical. Our whole employee wellness initiative is around financial, social, mental, and career wellness. And the effects of the COVID pandemic really hit our employees hard and really affected them in some of these areas and even all of them. That's why it was really important for us to have our wellness center offer the COVID vaccines to help with moving our employees forward, providing that sense of security and protection as they serve our citizens. So when COVID hit, Cary TC definitely did not miss a beat, and our wellness center remained open from the very beginning, and they began quickly providing virtual visits, and they were quickly implemented. And Cary TC was quick enough to get the number of tests that we needed, including the rapid test, to make them available to our employees. So then, since March of last year, we've had 95 employees test positive with COVID, and that's including those who were tested at the clinic, and we're tracking those who are even being tested outside the clinic on weekends. And then we do have record of 70 spouses and dependents who tested positive at the clinic. So our staffing model at our wellness center is 1 nurse practitioner and 2 medical assistants. So the city quickly put together a COVID team, and our executive leadership met weekly to discuss COVID. And the communication, our employees still compliment on that today, on how quickly that communication went out and the information that was provided by our city manager. She was the one that basically sent emails out almost on a weekly basis, giving employees updates on COVID and the CDC and providing links and communicating all of that to our employees. And posting things on our website, offering classes to our employees on communicating what was happening around COVID and providing education, basically even, debunking some of the challenges around that and some of the, I guess, rumors that are going around. The vaccine that we offered was the Moderna, and we strongly encouraged employees to get it. We even had a video of our city manager and some of our leadership getting the vaccine at the time and communicating that to our employees. So our phased eligibility considerations, basically, we use the CDC rollout plan. So our first responders, our firefighters, they volunteered at a lot of the hospitals and the events that were around the city of the Valley in Arizona, and they received their vaccines there. So we didn't have to provide the vaccines to our first responders. So we started with 1B and provided them to our law enforcement and our essential workers. So what we did first is we determined how many we're going to want to get the vaccine. So we used SurveyMonkey, and we sent out a simple survey with some questions and information and asked how many of our employees that were eligible during that phase, and we only sent it to them, were interested. So to our surprise, or maybe I would say our disappointment, we didn't have as many employees that wanted it that we thought were going to want it. And of course, this was really new because we're talking that the vaccine, I think the first one in the US was giving the middle of December, and we were already sending less than 30 days out an email asking employees if they were interested. So I think there was still some concern around it and employees wondering how the vaccines were going to impact them and the side effects and things like that. So of our 441 employees who were essential workers at the time that we sent out the information to, we had a little less than 200 employees that wanted the vaccine. So we right away got that list of employees, and that's how we started to communicate, was to those employees. So our first round of vaccines went to the employees who were essential workers and law enforcement that wanted it. And that's when we started the vaccines in the beginning of February. And in February, we gave the vaccines out. And then the second round of the first dose, we basically, because we had 60 vaccines left, we opened it up to the entire city of full-time regular employees who are interested in getting the vaccine. So right now we're at the point of we're trying to encourage our employees, more of our employees, to receive the vaccine, and we're looking at incentives. We have done some research in Valley cities and found that some of the incentive that other employers are already implementing as of July 1 for their new fiscal year is a reduction in health premiums. So if the reductions are anywhere from $10 to $25 a paycheck, and then employees who don't have the city's health insurance, they're looking at giving employees a taxable gift card. So those are some of the things we're doing. We're excited to be able to offer the vaccines through the great assistance of CareATC, and we're going to continue to move forward. And our next step is we want to offer them to dependents and spouses.
Thanks, Jeannie. I think Larry can move to the next slide. So I think Jeannie painted a great picture of the outcome of a vaccination event, targeting employees and getting a willingness to readily accept the vaccine. I think as we sit at the end of March now, the vaccines becoming more readily available. And I think attitudes towards the vaccine have improved. All of you have seen that the Johnson & Johnson vaccine has been available along with Pfizer and Moderna. And so we're seeing a higher level of willingness of employees and others that are looking to get the vaccine versus dealing with consequences of COVID. We want to take you all back a little bit. Just as you're working with a worksite health partner, there's a lot of preparation that goes into being able to secure and administer the vaccine. This is a much different product than the flu vaccine. That's highly regulated, and there are a lot of requirements that those that are going to administer and secure the vaccine have to go through. At CareATC, we started the process back in early November for all of our locations and client partners. And every state's just a little different in how they run the registration process. Number one, before you can even start the registration process, you have to prove that you have the ability to store the vaccine. So for Pfizer and CareATC, as I'm sure many of you are aware, that requires an ultra cold refrigerator, just something we weren't able to do. So we made sure that we submitted our applications to receive the Moderna vaccine. And as Janssen's becoming more available, indicated that we'd like to receive that as well. But when you're going through the registration process to be able to receive the vaccine, on that application, you're required to prove that you have the cold storage, the digital data loggers, the ability to monitor temperature, and that you have all the processes in place to make sure that you can maximize the vaccine delivery to a population and minimize wastage. They also have very strict requirements on reporting out of temperatures that are out of bounds or out of line. So you need to make sure that your health center partner has an infrastructure in place to really support that. In addition to that, as you're getting ready for events, there's a lot of training that each state mandates, and they actually check that in the application process. Each state does provide that training, but they're also looking to make sure that the physicians, medical assistants within a health center, and any of those folks that are going to receive and administer vaccine are approved to do so. So quite a lot of regulation to work through. With City of Goodyear specifically, the success here was because of the partnership we had with the city. The city advocated for CareATC, even worked with us to make sure that we had the cold storage on site and be able to receive the vaccine, and work very closely with the County of Maricopa, the jurisdiction that manages the vaccine. So in January, we actually received an audit of the facility, and we got approval to be able to administer the vaccine. And this is where Jeannie and her team started really working in January to identify those members to receive the vaccine. And we were notified January 28th by Maricopa County that we were going to receive the vaccine. And on February 4th, just before February 4th, we had 200 vaccinations and then started our event right away. So it's a very quick turnaround from when we actually were notified we were going to receive the vaccine to stand it up. And it required a lot of coordination on site, which we'll touch on in a minute. A lot of the things that really made a difference for Carrie TC and City of Goodyear was getting that willingness to receive the vaccine, making sure we had enough support staff on the ground and volunteers, because it was an event-styled deployment. So Larry, let's jump to the next slide. With the City of Goodyear specifically, instead of doing in the health center vaccinations, we wanted to maximize the number of folks that we could vaccinate. So Jeannie and the team determined that they were going to do a drive-up event. Talk about it in lessons learned. There's a lot of considerations when you're doing a drive-up event that you need to consider, including traffic flow in and out of the event, registration, and delivery of the vaccine. When you're doing the vaccine event, we worked with the city to make sure that we had paramedics on site, make sure that we had police and traffic control, and then those that were providing the vaccine, doing the registration and vaccination process. Also need to make sure that you have a provider on site, and then you have all the equipment that's necessary from a safety standpoint. That includes making sure you have EpiPens, ambu bags, and making sure that you have everything necessary, including PPE, to mitigate exposure, but also make sure you can take care of those that may have a reaction to the vaccine. During the consent process and the registration process, that's where you go through and make sure that you've got all the paperwork in place. You're screening everyone to ensure that they're safe to receive the vaccine. And for those that may be at risk, have a provider right there on the side that they can speak with in the event that there may be concerns, that you can monitor them carefully. The reporting requirements are pretty stringent as well. That's not just reporting out of receiving the vaccine. Every state requires that vaccines are reported out within 24 hours. You also have a report out or required report out on inventory management. How many vaccines you have on hand, how many you've used, and then basically how many employees or members that you vaccinated. Next slide, Larry. So when we talk about lessons learned when doing an event, one of the things that Jeannie did early on, and Jeannie, I would like you just to touch on, is working with the city planner and traffic flows. I thought it was pretty interesting what you shared with Carrie TC and just getting ready for the event and all the things to consider.
Yeah, so the experience I had, I got my vaccine in January through State Farm Stadium, and I'm not sure which is home of the Arizona Cardinals. And I saw their process and it was perfect. The flow was great. The problem that we had is we wanted to do it at our wellness center location, and the parking lot is not that big, and we weren't sure on the flow. So I was kind of imagining the perfect way they did it at the State Farm Stadium, and the way that our parking lot was set up. We thought we had the idea of how we wanted to do it, but I thought, let's talk to the professionals. So our city traffic engineer and our assistant city traffic engineer, we met with them. And of course, they changed the whole thing. And of course, they did a better job. And we wanted the flow to kind of be like a drive-through. But the problem with, and of course, you have to do it for each situation. We basically had the employees come in. We had parking spaces numbered. We had someone specifically there just to do the check-in, to make sure that the person that you have scheduled for your time slots. And we had 10 people for every 30 minutes. So it wasn't rushed by any means. And we had enough parking spaces and space in between to allow a smooth flow for the vaccines. And again, we did 4 days for the first dose, and we did approximately 60 people each day. So we only had the vaccine event for 3 hours. So it wasn't a lot of standing and outside. We were lucky enough that it was nice and cool, but it worked out really well. And I think employees felt really comfortable. You know, they didn't have to get out of their car. They were comfortable in their car. We were able to monitor them really well by writing the time that their vaccine happened on their windshield, and those who were monitoring when it was time for the employee to leave.
Thanks, Jeannie. I think the other thing to note there is because this was an event, Larry, if we go back to that last slide, because this was an event and it was outside, some of the things that you wouldn't consider, you need to take in consideration. For example, managing temperature of the vials. even though they're in a cooler, external temperatures can influence the temperature of the vaccine, which needs to be maintained. So making sure you have the equipment there on the ground is really critical, and that you have someone monitoring the vaccine. Once you've punctured the vial, whether it's Moderna or it's the Janssen & Janssen or Janssen Johnson & Johnson vaccine, all those doses need to be provided within 6 hours. So really making sure that you have everybody scheduled out and a wait list right there that you can call and get on site to minimize wastage is really key. And really, before even vaccinating, making sure that you have a team that runs through the event and plans for any kind of contingencies and issues that come up. Even though it ran pretty smoothly, it's because they really practiced quite a bit and did a lot of dry runs before actually starting to do the vaccination event. Once they got going, they were much more comfortable and were able to deliver the vaccines. But it's something that you really need to focus on minimizing wastage. Also, with Moderna, you need to plan out that second dose. And so that means getting a dedicated appointment 28 days after that initial dose is delivered, and ensure that the individuals you're vaccinating can commit to that date. And then if they do have any adverse reaction, make sure that they're reporting that into VSafe, but also informing the physician of the adverse reaction so they can determine what needs to happen with that next dose. So a lot of considerations you need to make when doing a vaccine event, especially when you're looking at a 2-dose vaccine. Next slide, Larry. And then just as I touched on in the beginning, as Jeannie said, at CARE ATC, we really we responded quickly to COVID, and for all of our clients provided virtual services. It's really become a standard of care, and it's helped to our clients to keep employees at work and safe, mitigated exposure to others, even developed a return to work strategy with all of our clients. And we have a stay at work app that we use at CARE ATC and a number of clients use as well to report it on a daily basis. Really utilize testing. We initially started with PCR-based testing, but have largely moved to health center-based Sophia antigen testing, and even event-style testing to be able to identify those that may be at risk. We worked with a large food process vendor out of California and provided 1,400 tests over 2.5 days so they could return to work as required by the state. And really the vaccine deployment program, even though this is event styled or health center styled, we just look, this is just going to be a standard part of our care. And then at CARE ATC, that we've really utilized our stratified targeted outreach using the analytics to identify those that may be at most risk. If you think about the chronic conditions, those are folks that are at most risk, and that's how we've utilized our system to be able to prioritize them, and then always provide everyone 24/7 virtual care.
Okay, thank you very much, Scott and Jeannie. We very much appreciate that. At this point, I'd like to turn it over to our next presenters. So we'll be talking about BAE systems with Marathon Health. And so we'll have Dr. Terry Lehman, Senior Vice President, Corporate Medical Director of Marathon Health, and Jessica Lafford, Industrial Hygienist for BAE Systems. So Terry, I'll turn it over to you.
Thanks, Larry. I appreciate that. And I appreciate the opportunity to come and talk to the NAWIC folks here today. So I appreciate that. I told you I was going to butcher that, didn't I? So my most proud title, by the way, those all sound like great titles, but I'm a family doc, practicing family doc within our clinics, and continue to do that today. And that's the title I'm most proud of. So as Scott had been mentioned earlier, we're a year into this pandemic now. It started, we didn't have a whole lot of warning with it. Marathon Health also spun up a global task force. We worked through a lot of processes, including testing, a return to work playbook that we published. I think you can get through our website, and have worked on event testing at this point, and as well as diagnostic testing and screening testing. And so we've spun up some drive-up testing sites. And lately, since November, similar to CARE ATC, and I'm equally impressed with the journey that they've had on this as well, we started doing the applications for the vaccines. And so I'll talk real briefly here about just some of the general principles about the vaccine registration process and why we have to go through this process. And then I'll turn it over to Jessica, who can give you some real world experience with it. So So just to back up a couple of steps from where Scott had started, the federal government purchased or pre-purchased vaccines from potential manufacturers, those including the 3 that are on the market right now, Johnson & Johnson, Moderna, and Pfizer. And so they pre-purchased doses long ago. Then they've distributed those doses through 2 main channels. They've sent those doses primarily to state health departments. And then they've also sent those doses to a number of pharmacies. They've partnered with over 20 pharmacies spanning across the country to put those vaccines out there into the public. And then they've left it pretty much up to the state regarding the state health department distribution channel. And the federal government has put some regulations or some recommendations on the pharmacy distribution channel. And so the states have taken their allotments of these vaccines, and they've opened up mass immunization centers referred to as open pods. Open meaning that the entire population is eligible to come in and get those if they hit certain requirements. Most states have been working through the requirements set out by the recommendations set out by the Advisory Committee on Immunization Practices, the ACIP, those being folks that are at high risk of death or mortality from the disease, so the elderly, and then also those folks who pose a significant risk to our infrastructure if they were to become ill. And so we've landed on those wave 1A, 1B, 1C, and 2 for the vaccinations as they're recommended by the ACIP. Outside of those open pods, there's also a closed pod distribution channel. Some states have not activated that yet. I believe Ohio has not. I believe Vermont has not. I believe Indiana has just opened or activated their closed pod distribution channel. And essentially, that is what you guys are wanting to talk about today. So closed pod distribution means that the state health department, or county health department, or local health department will partner with organizations, employers around their communities to supply vaccines for their populations. Now, it still has to be done through the state recommended guidance. So if they're going by an age basis, or if they're using job description as a criterion, it still has to be done through those channels. But these closed pods are these centers that we can open up and have opened up, and the ones that I believe Scott was referencing there with the drive-up facilities. And we've been doing this at 10, I think we're up to 15 sites now across our organization, and it's rapidly increasing as a lot of those states have started to activate their closed pod distribution channel. So I'm going to pause here and let Jessica jump in here, because she's been working she is with BAE, who has been a partner of ours, and she's been working primarily on this closed pod distribution for the BAE systems.
Thanks, Terry, and hello, everybody. Thank you for the opportunity. Just a quick background, BAE Systems is we run a Army ammunition plant, so it's a GOCO facility, so government-owned, contractor-operated. And we're acquiring vaccines through the U.S. government. So we are actually, because we're a part of the DoD, the Department of Defense, we were actually able to get some vaccines for our frontline workers, first responders, those kind of people. So being able to acquire those vaccines through them, it was very much a quick process, as I've heard mentioned on here already. It all happened very quickly. So it literally stemmed from a telephone call. Can you accept these vaccines? Do you have everything prepared? Sending all kinds of documentation that's required to get the vaccines and prepare for storage and actually giving the vaccine. So it was probably a 3-week process for us by the time we said yes we can, to actually getting vaccines in the arms of the employees. So it all happened relatively quickly, and there's multiple things that I feel like you should consider. Primarily is probably the scheduling of people. And Terry, if you want to intervene at any time, please let me know, but I'll just continue on. For me, the schedule was the hardest part, because we have a rotating shift of 12-hour shift workers. So they're working shift work. We also have people who are day shift employees. So we've got administration personnel, going to about 750 of those employees fell into our one category that we had to do for priority wise for the government, and even the government from through the Department of Defense. We had a few more criteria that we had to meet for them specifically. So it created several different challenges for us. We had very specific groups that we had to go through first and do, and then we rolled it out to our frontline workers. So we only had, I think, 400 people say yes to the vaccine. So very low number as well. But we have noticed that since that process has started, that now everybody is kind of volunteering to take it and or have been lucky enough to get it outside of our facility as well. So the shifts that we have to work off of, the government staff was very much forward in saying that we needed to provide those on a Thursday when the employees were going off on a 7-day off rotation, so that in the event that they had any kind of adverse reactions or anything like that, that they would not have to be at work the following day. So that created yet another strategy or challenge that we had to face. We had to do those at the end of their shifts, so they don't get off until 6:30 every evening. So it was a late at night campaign that we had to do. Some of our groups that we had to do prior to them, we actually started at 8:30 that morning and were able to work through those. One of the things that we really wanted to be sure of is that we got these round of vaccines and we didn't want to have to store them any longer than maybe 48 hours or so. So it was something that the schedule was super important, that we were able to get all these people in place in a timely fashion, and that the ones that we did have remaining the following day, that we were able to get those initiated or those vaccines also distributed to those employees who were wanting it. So it's almost like having a playbook, but having about 4 other playbooks to go by just in case, because you never know what's going to happen. Terry, I don't really know what else you want me to go with here.
No, that's fantastic, Jessica. So to circle back on a couple of comments that Jessica had made. Well, first, to back up, Scott had referenced the application process, and Jessica made that sound very simple on this, but for the traditional employer, that application process is long. We started this on behalf of a number of our partners back in November. We're just now getting access to some of that vaccine. So it does take a while to get that. Now, a lot of that was determined by when the state triggered the closed pod distribution channel. But it still takes a couple of weeks from the time that you complete your application to the time that you get an approval. And as Mr. Strickland had mentioned earlier, there's a lot of complexity that goes into those applications. There's a phase 1 application, or I think it's called an A application, which you just have to sign off that you're going to follow the rules, and that you'll be financially and potentially liable for a lot of things if things don't go well. And then there's an application part B that you have to sign off on that has all your freezer. We had to give the model and make number and year of our freezer and our equipment, what cloud monitoring device we had, what we were planning to do in certain events, et cetera. So that application process, I don't want to minimize that. And individual employers can go through that application process and try to do some of that, especially if they've got a robust internal, like medical director or medical process involved. But the folks on this call, I imagine, are mostly partnered with an on-site health center, and my suggestion is let them handle most of that. That's a headache that most HR departments don't want to go through. And then from the time that we get contacted, hey, we've been approved and we're going to be sending you vaccine, we usually find out about 48 to 72 hours ahead of time when they're shipping vaccine, how much they're shipping and which brand or which type they're shipping. So whether or not they need 1 or 2 doses, was our follow-up in 3 weeks or is it in 4 weeks? And so there's a fairly quick turnaround on that. You need to appoint somebody to be the vaccination director on the sites, so that they can have control and visibility into all those little variables that are going to be thrown at somebody on a daily basis, kind of out of the blue. So those things are extremely important. And then to follow up on what Jessica was saying a minute ago, the military had decided they were going to vaccinate their folks on Thursday. Well, you don't want to vaccinate all of your folks on a day that you're expecting people to be back to work the next day, because there's a very high percentage of individuals that have fever, chills, body aches, fatigue, and will otherwise call in sick the next day, somewhere in the realm of 25%. So if you put 25% of your security staff at home ill the next day, that's a problem. You put 25% of an essential workforce at home the next day, that's a potential problem. So although it's nice and tidy to bring down an entire department to work and to get their vaccine all at once, it's probably not the best business move to make, because you might be setting that department back a couple of days. So, and then one last point I'll make is that at the end of the day, there may be leftover vaccine. No-show rates in primary care run around 10%, and the vaccine is no different than that. So we expect about a 10%. Airline industry has their own standards for those type of things as well, and they overbook. For vaccines, we don't want to overbook, because you'll set up for disappointment and frustration, but you do want to maintain a wait list for these folks. Because if somebody doesn't come in, you don't want to waste even a single dose of these vaccines. These are precious vaccines that we're getting, sometimes 40 doses in an allotment. Sometimes we're getting 600 doses in an allotment, but whatever it is, we don't want to waste a single dose of that. And so we want to make sure that we've got backup or some redundancy on that schedule, so that we can call like somebody who's next in line to come in and get that vaccine same day at the end of the day if we've got leftover. So I think otherwise, Jessica, I think you handled all the stuff. Your experience at the health center as the vaccines were being administered was positive. Did you have any bad outcomes at the health center, or lessons learned, I guess, from any bad outcomes at the health center that you want to share with us? Or
not really anything horrific that happened. I think one of the most important things to consider, though, when you're getting ready to do this, is to develop and form a cross-functional team. I think that was one of our most important things that we did. We tried to involve many different areas and, just across our facility to try to consider all the different parameters that fell into scheduling, that fell into who's first on that list, where's the priorities lie, that kind of thing. That was super important for us, and we were able to kind of all collaborate together and make sure that we thought of each and every detail that we possibly could. Though we, we're under the understanding we probably forgot something, but we were going to be able to pivot pretty quickly to capture what we needed to do to fix that issue also. But thankfully, we didn't have any of those top issues. But I do feel like that a cross-functional team is super important, and just to maybe carry on with that just a little bit further. But having the adequate space to do this, we did conduct ours inside in an auditorium type atmosphere. So what I did was take how many people are going to be coming in this specific group and tried to schedule those out so that we had adequate time to clean in between sessions. We had time to kind of regroup as the providers were giving the vaccines. We had time to kind of regroup, gather, make sure we had all the paperwork and stuff in place. We have our own internal things that we were trying to track too. So I was doing that kind of thing as well. And it moved very quickly. The actual vaccination process took very little time, but we did obviously have a waiting period after the vaccine. So we had we kind of separated our auditorium out into two different phases. One phase was the people waiting pre-vaccination, and then we had a post-vaccination area where we had our EMTs and people stationed there in the event for any kind of emergencies and that kind of thing, which made us go very smooth. So we didn't have people like doubling through the same doors. We took that in consideration. We had pathways, designed specifically to keep social distancing and those kind of guidelines in check. So it worked very well for us. And then the actual vaccination took place in a total separate room. So they'd have to walk across a hallway to actually get the vaccine done there. So I think the cross-functional teams are so important. Adequate space and how you want people to flow through that. Especially if you're going to have a big group at one time. We did try to keep our numbers down as low as we could, but that's another parameter into the schedule that you do have to consider and really figure out what's best for your facility. So, and then identifying a trusted team member. For me, I've been here at BAE for 18 years, and I've worked in a lot of employees' health. I work in the occupational side, and having having someone that employees felt like they could go to besides their supervisor was super important, though very stressful. So if you're that identified person, be prepared. But, with the uncertainties of the vaccines and people unsure and have several questions, I by no stretch of the term claim to be in the medical field. However, I did do my own research, and I did reach out to our partners and our team members at BAE from Marathon and kind of talk to them about, if there were some super concerns that people had, address those and send them to, our team to address those. But, and also to come back and say, I didn't want the vaccine, but now I do want the vaccine. Being open and willing to understand that it takes people a little bit of time, and change is hard. And just being able to accept that with open arms, and never make anybody feel like, well, you didn't sign up for it, you don't get it. I think that's a misconception that a lot of people have tried to do, and I think it's a wrong approach. So for me, those are the biggest things: having a schedule and sticking to it as good as you can, but being prepared to pivot and having a backup plan so that if your first plan fails, you can go to the next one and move forward.
Yep. Is a strong point of making sure that you've got the logistics of the actual vaccination day worked out as well, or your partner has those things worked out as well. There's a 15 to 30 minute waiting period after you receive the vaccine that the FDA has recommended. 15 minutes for the average individual, 30 minutes for somebody who's got allergies to medical products and maybe a higher risk. And you do not want your vaccine event to become a super spreader event. And so making sure that people are spaced out and spread out for that 15 to 30 minute waiting period. If there is a backlog at the front, you're bringing people in waves instead of scheduled every 10 or 15 minutes, making sure that that waiting area is spaced out. Again, you don't want these events to become a higher risk event than need be. So spacing those out and timing those out, I think, is incredibly important. So thank you, Jessica. So just to kind of follow up on this, a cross-functional planning team, I think, is super important. We've had we've actually broken our task force into a smaller group to focus on nothing else other than vaccines. And so we've got about 8 people on that group that work on just the vaccine administration and registration part of things. Being aware of the state requirements and the federal requirements in Jessica's part, making sure that we've are following their algorithm for who gets it and who's eligible for these vaccines and everything, making sure that the space is adequate and that the timing that people are close together is adequate. Making sure that you have a budget for these things, right? Space is not free, time is not free. Those folks who are given the immunizations, they're probably not free. The storage and the facilities to store those things, that's not free. All those things add up over time. So making sure that you've got a budget for this so you don't run a little bit short and try to cut corners at the end. And then make sure that you don't know which vaccine you're going to get. So making sure that you're planning for all 3 of them. As Jessica pointed out, we have operated on a just-in-time kind of a basis where we have spun up these schedules and these immunization scheduling app on our site so that folks can schedule quickly and the word gets out very quickly. And that way we're not worried about storing them long-term. They've been coming to us in kind of the partially thawed state. And so usually I think it's about 6 to 12 hours of continued thaw. So the day after we receive it, we can start administering it typically. And then you can go on to the next slide there. And then have an on-site coordinator, as I pointed out, making sure that somebody is well aware of the things that need to be done. And when that phone call comes in and what you're going to receive and making sure they know next steps so that things can happen kind of just in time. Making sure that somebody can field those questions. You're building in that redundancy to the vaccine schedule so that you're not at the end of the day having extra vaccine left over and you have to dispense with it in some way. Making sure that you've got scheduling that the employer has their schedule redundant so that we're not taking out an entire department all at once and potentially taking away 25% of their workforce the next day. And then just making sure that you're sticking to the plan, like get a well-oiled plan lined out, agreed to, and work with it and then stick to it. And then the other thing I'll point out that's not on this list here is making sure that we're educating folks out there. So we can do all this work, and if nobody signs up, then it's wasted effort and wasted time. So making sure that everybody's got their education out there. So we've been providing education for a lot of our clients and a lot of our brokers and whatnot. And I've been doing webinars as well for them, and other people have been doing webinars to make sure that everybody feels well educated and comfortable with this. We don't want to force anybody to take the vaccine, but we do want to have people making informed decisions on this. With that, I'll stop there, Larry. I appreciate the time.
Great, thank you very much. I think that's an excellent overview. What I'd like to do in our remaining time then is to go around the table, ask, and if anybody has any questions. The first 2 that came in was for both of you. Did you also do dependents at those sites?
City of Goodyear did not do dependents at this time. We want to, but we focused on employees first.
Okay, Jessica?
We did not either. We are not, we actually can't have dependents on our facility. So anyone under the age of 18 that cannot be on our facility due to security reasons and stuff.
Terry, is that typical? That's what you're seeing?
Yeah, it's what we're seeing, especially through the closed pod distribution channel. Those are
Mhm.
typically limited to the employees only there, but each state's, as we're finding out, each state has very different regulations, and for states that would allow us to do that in a closed pod distribution channel and they meet the other requirements, that's certainly something we would consider.
Scott, you getting requests for that?
Yeah, we are, and where we're providing vaccine in other areas, as Terry said, it really depends on the state and the phase that they're in. So we have provided vaccine to spouses and dependents that meet the criteria. I'm just made to make sure that they have documentation that they're meeting the criteria before you provide it.
Great. Also, a question came in. Did you have to increase the number of your staff, and did that then force you to reduce services at the worksite center? Jessica?
No, we did not have to add any staff members, and it did not impede our normal day-to-day operation stuff. And we tried to be very open and honest when that was going to occur, so that people knew that there may not be the staffing in our clinic as typical, that they were going to be doing this, this event, and it seemed to go off very well. People were very receptive to it.
Jeannie?
We did not get additional staff. However, the 3 hours each day of those 4 days that the vaccines were provided, the clinic was closed for appointments because we were using the parking lot and the facility and doing all that.
Yeah.
So that's just what worked best for us.
Okay, great. All right, I'm going to go around the table now. If for those I've indicated, or at least I see are registered and attending, if you have questions or comments or your own experience, please share it. So Tim Newman, comments or questions, Tim? And I know I'll have to unmute people as I call them. So bear with me while I do that. Also, if there's some phone numbers listed, some people may have called in. And if I don't call your name, let me know how to do that. So let me find.
Larry?
Here we go. Yeah, go ahead.
If I could mention one thing, the things
Sure.
that Terry all mentioned on lessons learned were great. I could concur with each one of those. And one thing that I wanted to add was our scheduling system could not accommodate. And as Jessica said, scheduling was very difficult. I'm sure I have twice the gray hairs now from all of that, because the first round, we kind of did that on a manual process.
Mhm.
And what we did was I got smarter after the first time, and I went to our IT department and we rolled out MS Booking. So that's part of our Microsoft products that you automatically have. And MS Booking works amazing. It's really easy to set up, and putting that out there and setting up, you can schedule 10 appointments for the same time slot. And it puts it on their calendar for work. It sends them reminders, all that. So that's kind of how we scheduled the second round. And we're talking 1/10 of the time. And if people can even go in and update themselves, if they need to change their appointment rather than contacting somebody and manually doing it, they're able to go in and reschedule their appointment for a new time. So
Great.
MS Booking worked really well for scheduling the appointments on the second go around.
Thanks very much. Tim, any comments or questions?
No questions. We have a large company of 12,000 people, and but it's dispersed over 5 different states. So we were not able to do anything as a centralized effort. In one of the states, in West Virginia, we were able to partner with the health department, I think as Terry was mentioning, and they provided it to our workers in that kind of distribution manner. But otherwise, we're just waiting and following through with the states who are now opening up to employees, getting vaccines in that manner.
Great. Thank you, Tim. Alex Jordan. Alex, comments or questions?
Yes, first of all, I'd like to thank the panel for the content today. It was great to see the collaboration that everybody went through to make this happen. I did have one question about your experiences through the schedule management process and kind of how you guys worked together to balance the roles and responsibilities between clinic administrator and employer regarding kind of the scheduling process, schedule management process, because as you had mentioned, it's a very tight window from when we receive it to when you got to activate a schedule to get shots in arms. So I'm curious how that played out and maybe some lessons learned or best practices you guys had come up with.
I'll chime in here. So, so lessons learned are, I'd say, a tight partnership with our employer partners. Understanding what their need is super important. So some, have folks all off site, and their need is to get everybody immunized as quickly as possible. And they want a mass event, and just to, not without concern about which department they work in and those type of things. For the majority of our folks, they're working through a fairly, their departments aren't necessarily all hitting the same age requirements or same healthcare status requirements at the same time. And so right now it's kind of happening on a natural basis, just based on the age grade. So if one department happens to all be over the age of, say, 50, and that's open in their state, then that might run into a little bit of a problem. But with most departments and most of our partners and our employer partners, they've got 20-year-olds to 60-year-olds working in each department. So it's kind of happening on a normal basis, and just making sure that they're aware, and they can kind of sort of set some of those gating criteria as to when people will be able to take away from their desk to come down and get the vaccine.
Yeah, one of the things, I'm sorry.
Go ahead.
Go ahead, Jeannie.
So for the city of Goodyear, we work closely, and basically HR for the city of Goodyear was the contact basically between the employee and the event. So we worked through them to scheduling them, setting the times. Then HR was the contact and partnership with Carrie TC, that as the events were going, if there were somebody that was a no-show, they were contacting us and letting us know. And then we were using our standby list to make sure of our 200 vaccines, we lost 0. As a matter of fact, we gave a few extra because sometimes there's extra in the vials. So we were able, when they called and said, we have extra, we were calling the list and giving out more than the 200 vaccines that we had. So it worked out really well. It just, I don't know, kind of until you do it, it's really hard to even explain it somewhat. You just have to make sure that you have contact and have that wait list that you can send people. But when you're talking about 10 vaccines and not losing any of them, and some people are even deferred, because of course, they fill out their consent form and they're deferred at the last minute, or 3 employees call you in the morning and say, I can't make it. So that was the difficult part. We have an employee for the second dose, he got accepted to the American Ninja Warrior show. And the first vaccine, he had a really bad side effect from it. So he's not getting one. So of course, of the 200 we had scheduled, we have other people that we filled in for that. But it's interesting how there's so many different things going on and coordinating that. But HR was the contact with the employee, and then HR coordinated that through the clinic. So the clinic, their priority was really making sure that they were handling the vaccines and doing all that. And once the employee got to the event, but we did everything else.
Yeah. I think just where I was going to go real quick is, like testing, this is evolving very quickly. I think we've seen early on in testing, there was scarcity of testing, and then just the innovation that took place over several months. We're seeing the same thing with vaccine. We did with the city of Goodyear. Carrie TC, we've developed a scheduling system. We just wasn't ready to roll. So we had a tight turnaround time. So one of the things that we've done is followed each state's lead and have an application process where, Terry, like what you all are doing at Marathon, people are submitting essentially an application to receive the vaccine. We're asking a lot of the questions up on the front end to make sure that they qualify for the vaccine and really get the consent process done pretty quickly on the back end. So that way, when it's time for the event, you're likely to see a maximum number of participants come through. But to Jeannie's point, Terry and Jessica's point, it's really critical to have that wait list and people that can be at the site within a couple hours, because you're guaranteed you're going to have either extra doses or some people that don't show up. So it's really important to do so to minimize that wastage.
Thanks. Let's go on. Amanda Green, Amanda, questions, comments?
No, thank you. Wonderful presentation.
Okay. Bruce Hochstedt, Bruce, any comments or questions? Go ahead, Bruce.
Hey, Larry, you caught me with my mute button on.
Okay.
No questions, just token of gratitude to the 4 presenters sharing unique stories on how our industry has stepped up and supported critical businesses during unprecedented times. Thanks.
Thank you. Deborah Olushina. Deborah? Comments or questions? Okay. Ed McNamara, Ed, any comments or questions?
No questions. Thank you to all the presenters.
Thank you. Francis Ducar. Francis, any comments or questions?
No questions. Thank you very much. Very informative.
Okay. Greg Howe, any comments or questions?
No questions. Just a big thank you to Jessica for partnering on this. A lot of work.
Okay. Jessica Schaefer, any comments or questions? No. Linda Starks, any comments or questions? Linda Starka? Okay. Linda Bota, Linda, any comments or questions? Okay. Sheila Schneider, Sheila, any comments or questions?
Yeah, hi Larry.
Hi.
Just wanted to comment, thank you all. We have been successful in procuring vaccines for 3 of our locations across 3 different states. And I just want to echo some of the sentiments that you guys have just with, we're all working through this, no playbook. So some locations, they went off really well, and in other locations, it's been a little bit clumsier. I think just the converting from wait list to an actual appointment, we're having difficulty in getting the people that were originally interested to actually pick up the phone now and schedule an appointment. But one of the other things that I wanted to find out if any of you are hearing is hearing about a potential needle shortage, the kind of the smaller needle that's used for the Pfizer vaccine to get the 6th dose out of there. Are you guys hearing any of that?
I think that last I heard is that the CDC is moving to the retractable needle, and they're going to be supplying other needles. And this has been pretty common. Terry, Jessica, I'm not sure what you all are seeing, but it's the supply chain issues. I think largely that we're just reacting to on a daily basis.
Yeah, so there's been a bit of a needle shortage that they're using the low waste needles in those to kind of push out as much vaccine out of the hub as possible. They're running a little low on that, but as Mr. Strickland pointed out, like that's not unexpected. The vaccines we had vial shortage in the very beginning. They couldn't they didn't have the vials to put the vaccine in. Now they've got those. Now we're running a little short on the needles that the manufacturers are actually sending out with the vaccine kits and everything. There's a little bit of a shortage, as everybody knows, about PPE, the masks and everything that we wear. And then there's been a little bit of shortage in gloves. So we're going to see these just like we saw with the swabs and things like that. It's going to come and go. I'm not particularly concerned about it. We'll kind of keep an eye out for it and everything, but we'll work through that shortage just as we work through all the rest of them.
Thank you.
Awesome. Thank you guys so much.
Yeah. Mackenzie, any comments or questions?
Yes, thank you to all the presenters. It's really nice to hear your information, and it's very helpful. As we approach everybody becoming eligible, like probably May 1st, we're looking at doing mass on-site events, and I wonder what your thoughts are on walk-in versus scheduled ahead events, pros and cons of each. If you've got any experience with that. Thank you.
I'll jump in. Ideally, that's where we want to get to. I think, Mackenzie, part of the challenge there is with Moderna, you have a 10-dose vial that has to be used within 6 hours. So you've got to really compress the time that you really have and the number of participants. Eventually, we're confident that I think that we're going to get to more of a single dose. But right now, because the number of doses that come through an individual vial, it makes it really difficult to manage a walk-in. Now, you can encourage scheduled appointment times, but the walk-ins are going to be really difficult to accommodate. And then just reacting to May 1st, I think what we're seeing is within each state, ideally we hope that there's enough vaccine that it's going to be readily available. Texas on the 29th is moving to all adults, but they're dealing with a shortage of vaccine availability. So, hopefully that time frame sticks, but just given the availability of the vaccine, it's really hard to say when it's going to be readily available.
Okay. Ann Gibson, Ann, any comments or questions you have? No? And Shelley, any comments or questions?
No questions. Just thank you to the panelists.
All
Thank
right.
you, Larry.
Thank you. I have a final question. As more of the one-shot J&J vaccine becomes available, do you think there'll be an option for employers and vendor partners to get that vaccine, or it'll be based solely on the state?
We actually were asked by the state of Texas if we would be willing to receive the Janssen vaccine. We've both applied to receive Moderna or Janssen. We actually received the Janssen vaccine in Texas, and other states are starting to follow suit. Larry, I think it's more on availability. And as Jessica and Terry said, being prepared to be able to administer any vaccine that you get is really key.
Gotcha. All right, if there's no other questions, I do want to thank our panelists of the day, Jessica Leffert, Scott Strickland, Judy Rudy, and Terry Lamont for their participation. And I hope you've all found this helpful. This has been recorded, and we'll have the slides available for anybody who is interested in reviewing this again. Our next program will be at the annual forum, which we'll probably have something in between. But please look at our LinkedIn site and nawhc.org for updates on our programs. Thank you all for participating and for your time. Stay safe and stay well, and enjoy the spring weather. Take care. Bye-bye, everyone.
Great day. Bye.